So today we'll be talking about coma. So what is coma? Coma is a state of unconsciousness. So unconsciousness meaning the patient is not able to respond to any external stimuli. The stimuli could be a verbal stimuli, a painful stimuli, an olfactory stimuli like a smell. So the patient is unable to respond to any of these stimuli. Then the patient is said to be in a deep coma. Again, coma is classified by doctors based on the scale called the Glasgow Coma Scale, wherein the patient is, wherein the doctors check how the patient is responding to various stimuli. Like, for example, if the patient responds to verbal stimuli in a very coherent way, like if you ask the patient to raise his right hand and he does raise his right hand, then he is said to be very alert and he gets 5 points. Versus if he's mumbles up and just instead of right hand he just kind of lifts his left hand or something else, it is not coherent, then he gets probably a 3. Versus if he just doesn't do anything and it's just has a blank stare, then it's probably a 1. Similarly, how does he respond to painful stimuli like a pinprick or a pinching? How does he remove his hand and remove the palm away, or does he doesn't respond at all, just lay still? That means he's not responding to pain, whether superficial or a deep pain. Then he gets a 0 or a 1. Similarly, is he alert? Are his eyes open? So all these get, is he conscious, unconscious, totally, or is it delirious? So everything gets a point depending on, and then your doctors add up these points, the aggregate of this. If it is less than 8, then the patient is considered to be in deep coma. If it is more than 8, then a little bit moderate, and then a little bit more, then it's milder variety of coma. So milder coma. So this is how the doctors categorize coma. Okay, so we talked about what is coma. Now, why do patients first of all slip into coma, or what is this state of unconsciousness? Why do they get into the state of unconsciousness? So it could be due to various reasons, metabolic reasons like diabetes. When it's very high sugars, the person can slip into coma. Or it could be due to low sugars also. Hypoglycemia also, sometimes person slips into coma. It could be due to a road traffic accident where the person gets hit on the head, or it could be a blow on the head. It could be due to intoxication, alcohol intoxication, or intoxication with drugs. It could be due to infections like meningitis or encephalitis and infection of the brain. Or so these are the various reasons why a person can slip into coma. So how do we treat a person who's in a comatose state? So initially the doctors make sure that the basic life support is given to a comatose person, especially if he's unable to breathe well and all that, then all the life support is given. Later on, you try to find out what the reason is for the person to have slipped into this state. If it is, for example, due to hypoxia or lack of oxygen supplied to the brain, it could be because some of his blood vessels to the brain has been blocked by a clot, or it could be due to hemorrhage. Then a CT scan or an MRI scan will be able to tell whether there is a clot, and then they accordingly give a clot buster, or anything else needs to be done, they do that. If it is due to, for example, diabetes, if it is high sugars, then they try to give medications to correct the sugars. If it is due to alcohol intoxication or any other drug overdose, then an antidote is given to bring down that. If it is due to a road traffic accident, if there's some injury to the brain, then maybe there is a need for a surgery, and a surgery is done and the person will get better. So depending on what is the reason for the person to first of all get into the state of unconsciousness, the treatment also is done accordingly. So the person may be unconscious for a couple of minutes, a couple of hours, a couple of days, a couple of weeks, a couple of months. So depending on what is the reason, again, the duration can be any longer. So I usually get some questions, and one of the questions which struck me was that doctor, does the patient would he or she be able to hear us when they are in this state? So the answer to it is 15 to 20% of the patients actually are able to hear and also feel some emotions. There was this experiment done by scientists wherein this patient was comatose for almost 12 years, and this patient was put in an fMRI scanner, and the doctors asked him to visualize that he's back home playing his favorite sport. And believe it or not, some parts of the brain actually lit up. It was active when they saw in this MRI. Those parts of the brain were active. That shows that he's actively thinking or visualizing that he is playing or he's in his house and he's happy about those emotions. So it's kind of stimulating it, right? So it's always a good idea when you are, if you're seeing a patient who's comatose, if you know the person, if you know his habits, his likes, his dislikes, it's good to talk about them. Talk about something which interests him, which he loves and he or she loves, and you never know, it may strike somewhere and it could stimulate. It's just a possibility, but it doesn't hurt. So yeah, that's about coma. If you have any other questions or comments for me, please go ahead and put that in the comment box below, and we'll see you again. Bye bye, and thank you so much. Bye.